Welcome to OmniCurious Originals. We are celebrating the Diabetes Awareness Month, and today we have Dr. M.K. Singh with us. Dr. M.K. Singh is the present chairman of RSSDI Jharkhand chapter. He is also the founder of Diabetes and Heart Research Center Dhanbad and is well known for original works on diabetes prevention campaigns. He is also the organizer and editor of Dhanbad Action Group and CME India platform. We are very pleased to have him today with us. Welcome, Dr. Singh. The stage is all yours. You may please begin.
Yeah, thank you, Vaishnavi. Today, I am thankful to the OmniCurious platform, which is a unique topic. And I think in India, this topic is hardly covered in detail. In any conferences, you will get lots of scientific research papers, but I find that the science and art of physical exercise, so it is so important, but it is missing in most of the conferences. So one way, I think that they have filled the gap. So my today's topic is basically related to the science and not only science, but also the art of physical exercise and basically in diabetes treatment and the prevention. This topic, how I got motivated is from the Orlando ADA in 2018, where I attended this ADA, and there was a session, as you know, in the ESD, that is the European Society for a Study of Diabetes, and ADA, that is the American Diabetic Association conferences. They are the Mahakumbh of diabetic conferences in the world, and you will be surprised that they keep at least 6 to 8 hours, even sometimes I have found 12 hours, just they discuss science of exercise. And there was a topic of 45 minutes where this lady discussed that there is amazing science of exercise, but why do we fail to follow? So basically she talked on a art of the exercise. So my disclosures are none, except that this motivated by this lady who talked 40 minutes at ADA, but no guarantee this will give you any extra knowledge and modification to sustain behavior change to you. But I am very happy to waste your time, next 30 minutes, with this slogan that any movement is better than none. Appreciate the levers of sustainable behavior change. So by this, I will devote my 20 minutes to the science, and I would like to tell you something about art of the science in next 10 minutes. As far as diabetes is concerned, there was a time when it was thought that exercise is dangerous in diabetic treatment. But this gentleman was the first clinician to introduce the intelligent use of exercise in treatment of diabetes. In that time, when most of physicians did not approve of exercise in diabetic patients, from that point came the 1919, when a study conducted by Allen, and he concluded something new, and then the total regulation was possible in the treatment of diabetes by exercise. This was the conclusion. And with the use of exercise that time, now patients were allowed to consume more food, which was a liberty uncommon in the diabetic clinics. So this was a sea change in the concept of exercise in diabetes. And you will be surprised to know that the type of exercise he suggested in the conclusion of this study involved exercise of high intensity followed by rest periods of low intensity exercise. And this is very similar to the principle of interval training, which is the base of many modern athletic programs today. So this was really amazing. So what is amazing in exercise? This is my Facebook friend, and I have met him in the Vienna ESD once, and he is the founder of Type 1 Diabetic Novo organization is there, and you will be surprised to know that being a diabetic since age of 6 months, a Type 1 diabetic, and there was a time when his doctor told कि ये आदमी 20 साल से ज्यादा नहीं बचेगा, not dead yet, but he is not dead yet. He has written a book available on the net, you can read it, Not Dead Yet, by Phil Sutherland. He tells exercise is the billion-dollar drug that never gets prescribed. There are lots of things happening with the exercise apart from the this cathepsin B secretion from the skeletal muscle, improving your memory, prevents injury-associated loss of BDNF, increase osteocalcinin with bone health, and lots of things I will discuss in detail. So let us have a look at what is the science of exercise. My view is unless and until you know the science of exercise, you will not get the energy to do the exercise or to sustain the regular exercise. So it is very important to understand the molecular mechanisms, and if it gets imprinted on your psyche, it acts as a motivational force to do regular exercise. So diabetes care physicians need to know this and then translate it to patients in simple way to make them move on daily basis. So this is the aim of this talk. In a very simple way, muscle contractions have a powerful effect on how the body processes glucose, the original biofuel. And as you know, the muscles are the major consumer of glucose during the exercise. In each cell, muscle store dense packets of glucose, accounting for around 2000 calories, which is worth of energy that is throughout the body. But this energy is just stayed there unless you contract the muscle and tell your patients, and this will motivate your patient. Very, very important that during intense anaerobic exercise, that is the exercises which you do in the gyms, that typically last only seconds to minutes, hepatic glucose production may reach 15 milligram per kg body mass. And this is an amount that exceeds muscular glucose disposal. To match peripheral glucose disposal into working muscle, something happens in your body. The second pathway created during exercise is a boon for anyone with the type 2 diabetes, and which is marked by insulin resistance, which is a very important factor in the causation of the diabetes. So when the body is at rest, it has one mechanism to getting glucose out of the bloodstream. That way is the insulin, you are well aware. But what is so good about exercise is that even if the muscles are insulin resistant at rest, that becomes irrelevant with exercise. That is the most important thing I want to tell. So exercise starts its job by placing an energy demand on skeletal muscles, and with utilization of glucose and fatty acids, generation of ATP occurs. So both insulin and exercise increase skeletal muscle glucose uptake by translocation of glucose transporter known as 4. So exercise, remember, has no effect on insulin receptor, only it modulates the post-receptor insulin signaling. Receptor के बाहर सेल के अंदर it modulates post-receptor insulin signaling. This is the acute response to exercise. What happens here? I will not go in details here, but remember, ultimately there are key fuel metabolic genes like PGC1 alpha, PPAR beta or delta, or PDK4. So these are orchestrated when within the skeletal muscles by increased expression for functional response. So what is happening? You are doing exercise and you regulating your genes by exercise via genetic variation, transcriptional factors, the messenger RNA, histone modification, CpG, Adenylyl methylation, ultimately leading to what? Ultimately leading to increased insulin sensitivity, increased oxidative capacity, and increased mitochondrial content. So mitochondrial function is known to control regulation of peripheral insulin sensitivity. So most exciting relevant science to acute exercise is that it activates alternate molecular signals that can bypass defects in insulin signaling in skeletal muscles. So it results in insulin independent. Remember, I am telling it results in insulin independent increase in glucose uptake. So insulin is not required for glucose to enter into the cell when you exercise. This is known as contraction mediated uptake, CMGU. a form of non-insulin dependent glucose uptake. So essentially, muscle contraction allows glucose to enter the cell. You tell your patients what is this miracle happening with exercise. So I tell my patient what is known is that this pathway is not affected by people with type 2 diabetes, making exercise a prime method for improving, at least controlling the disease. Even if you have become a diabetic, this pathway contraction mediated uptake remains live. And after exercise, it continues for several hours post-exercise. So this is again a very, very important thing. Or remember, if you are doing aerobic exercise, an acute bout of endurance exercise, that is the aerobic exercise, that improves insulin sensitivity for a period up to 48 hours. So amazing thing that exercise is that it exerts its effect very quickly. And there are long-term benefits too. But you will also get acute effects and benefits with exercise. There are lots of science in it. I will not go in details of all that, but physical activity leads to a number of physiological adaptations in the body. And in this regard, the beneficial effect of physical activity and exercise, lots of things happening like improved body composition, your decreased the visceral adiposity, improved lipoprotein profiles, insulin sensitivity and endothelial function, everything improving. Reduction in resting blood pressure, resulting heart rate, and reduction in systemic inflammation. So lots of things are happening. Again, a recent study has concluded from the Diabetologia that resistance exercise is also very important. It improves the cardiometabolic risk factors and serum metabolome even in the previously healthy young men. So this is very important to prevent it. So ultimately, exercise leading to lots of things are happening, leading to cardiovascular improvement. I told you, like the myokine, interleukin 6, FST1, I would like to go in so details of the myonectin, but everything, these are very important for all this improvement in the cardiometabolic health. Everything is happening nicely. So, but the key points are that the regular exercise induces anti-atherogenic adaptations in vascular function and structure. Irrespective of the traditional cardiovascular disease, this is very important to understand. So, regular exercise training improves cardiac parasympathetic regulation, thereby conferring protection against malignant arrhythmias and also provides cardioprotection against ischemia or perfusion injury. And muscle-derived myokines are responsible for many of the beneficial effects of exercise, particularly by promoting a healthy anti-inflammatory milieu. Even lots of problems happening today in diabetes with the fatty liver. You are aware, NAF, LFD. But when you do regular exercise, again, things are happening which leads to decrease in non-alcoholic liver fatty disease. So this again it becomes very important for fatty liver changes. And this has been shown that even with this study, even you have got a NAS, hepatitis, then by weight loss, resolution can occur. It depends on how much you are able to lose the weight. So one part of losing the weight is definitely the exercise. And also the way the many drugs are working, that is the AMPK activation, and the take-home message from the exercise is that this is intimately involved in the most effective treatment, and this is also done by the exercise. This is again important that when you do exercise, you are able to regulate white adipose tissue, and browning occurs, and brown tissues are very good for your health. So this you can do only by exercise. And there are lots of research going on with the irisin, that is the feel-good myokines, that is also induced by the exercise, and its levels increase in individuals undergoing aerobic training. So lots of things again happening with these myokines, lots of research is going on, and this has some role also, and lots of pharmacologic therapy might be coming with the irisin, but I will not go in detail of that. But now, what type of exercise, again, is a big question in front of you. So, is it better to do aerobic training or resistance training? Remember, that if you go for the neuromuscular adaptations or metabolic adaptations, something which resistance training can do, it cannot be done by the aerobic training. That's why the reason that the American Diabetic Association and ESD changed their guidelines, and they told that in diabetic patients and in the most of our cardiac patients where this is very important, you should combine both aerobic trainings and resistance training, because it is only the resistance training which can increase your lean body mass. It can decrease resting insulin level here also, but remember here, the lean body mass is not affected by this aerobic training. This is only can be done by the resistance training. So this is very important that you increase your lean body mass, and like aerobic capacity to increase, very important to get these new things has come in the guidelines. And this was a very important lecture at the ADA. The concept is now going that if the beta cells are not dead from the apoptosis or marooned in the state of advanced cellular degeneration, they become quiescent as a de-differentiated cells, and this is a possibility to restore beta cell health even after onset of hyperglycemia. And this you can do. A journey from beta cell to alpha cell becomes, then you becomes diabetic. So from alpha cell to you can even go to the beta cell. This is possible, and one way could be the exercise also. Sometimes there are lots of things people ask in the corona era how to do exercise. Remember, even if you do exercise, as the corona or basically is creating trouble to those whose immunity is weak, but you can improve that, because active exercise stimulates the interchange of innate immune system and components between lymphoid tissue and the blood compartment. Although transient, a summation effect occurs over time. So what happens? The immunosurveillance improves against pathogens and cancer cells, and decreased systemic inflammation occurs. So this is again a very important thing. So this is a very important slide. How exercise augments host immune defenses is multifaceted. But the key mechanism is the frequent mobilization and redistribution of effector lymphocytes. I will not, I think, aware that billions of lymphocytes are mobilized in response to just a single bout of exercise, particularly if the exercise is dynamic and taxes the cardiorespiratory system like running, cycling or rowing. So importantly, there is a catecholamine-mediated preferred mobilization of those lymphocyte subtype that are capable of tissue migration, and their phenotypic signatures indicate they are primed and looking for a fight to recognize and kill the virus-infected cells. And this could be very, very important these days. Even the memory T cell are mobilized with the effect of the exercise. So your immune defense increases with regular exercise. This has been shown with the very important research done within last 2 or 3 years regarding the immunosurveillance. So very important to tell you that the acute exercise, moderate to vigorous intensity, less than 60 minutes, is now viewed as an important immune system adjuvant to stimulate the ongoing exchange of distinct and highly active immune cell subtypes between circulation and tissues. Lots of science is there. It will take hours to tell you. But remember, everything is happening in a good direction. Also, the new concept is coming about the immunosenescence, and this is defined as immune dysregulation with aging and related to an increased susceptibility to infection, autoimmune disease, neoplasia, metabolic disease, osteoporosis, and neurologic disorders. You can modulate again this thing by exercise. So there is an increasing evidence that the circulation surge in cells of the innate immune system and each exercise bout and the anti-inflammatory and antioxidant effect of exercise training have a summation effect over time in modulating tumorigenesis, atherosclerosis, and other disease processes. I will not go in details of the science now because we have also talked about some art. But remember, even by doing exercise, the studies have shown that you can get less viral infections, less pneumonia. This has been shown. So this is for the corona-based discussion. So I will tell you that exercise might not prevent us from developing COVID-19, but it is our perspective that physical activity will help maintain and counteract the negative effects of isolation also and confinement stress on immune competency, and should therefore be strongly promoted during this worldwide mitigation strategy. This is very important. Now, few things about how to exercise. Remember the FIT. F is frequency, I is intensity, T is time, how long to exercise, and T is type, what should be the mode of exercise. So I will tell in detail about something about exercise of an aerobic exercise and resistance exercise. Then other part is the high intensity interval training, also called as high intensity intermittent exercise or sprint interval training. And this training, this has become very important in diabetes. This is a concept where one performs a short burst of high intensity exercise followed by a brief low intensity activity repeatedly until too exhausted to continue, and this is found very important to improve the insulin sensitivity. So this is how you start. You can learn this sort of exercise from just typing the high intensity exercise in the YouTube, and you can get all the details about this. Lots of science is also here there regarding this. But my whole, I want to tell you that today it is very important to understand that resistance training is critical for us, like this. जो दंड बैठक करते हैं आप लोग या इस तरह के एक्सरसाइज करते हैं, दिस इज वेरी वेरी इंपॉर्टेंट with for the normal loss of muscle mass with aging occurs, accelerated loss of muscle with physical inactivity, disease including diabetes, everywhere it is very important to do this. Because lots of studies have shown that this resistance training is more effective at improving the glucose transporter 4 number and function. And due to the intermittent nature of the resistance training exercise, it is often better tolerated than the aerobic training with people that also suffer from fatigue. Suppose a patient is suffering from fatigue, there is some osteoarthritis of the knees, cannot do the aerobic exercise. For them, even at the home, the resistance exercise can be done. It is highly effective to slow sarcopenia, which is very much related with the type 2 diabetes, sarcopenia. Now, interrupted sitting is a very dangerous, interrupted sitting is a thing which you also tell your patients that another promising exercise intervention may improve glycemic control. So this is also very important ki interrupted prolonged sitting with brief bouts of some sort of exercise you do, like light walking, that attenuates the acute postprandial glucose, insulin, C-peptide and triglyceride response in adults with type 2 diabetes with poor adherence to structured exercise. This approach is very important to do. Even the all daily movements which you do in your household, like dog walking, gardening, these all are very important, and this has all shown that this reduces the everything that is happening in back direction in the diabetes. Even with walking is a dog, with your dog could be a very good intervention. If I ask you which one is better, the intensity of exercise or duration of exercise, remember the current research clearly demonstrates that intensity is more important than the duration. At low intensity, what happens for an extended period of time, fat becomes the primary fuel source. So if the fat becomes the primary fuel source, this is far less effective in lowering the blood glucose levels. But if you do a high intensity exercise, ranging from moderate to high, utilize more carbohydrate like glycogen for fuel, therefore are more effective at lowering blood glucose. So if you want to lower your blood glucose, intensity is better. And this also improvement of glucose metabolism are observed during moderate intensity endurance exercise. So may have the most beneficial effects and can be successfully performed even in obese diabetes, that is the most true. So when both aerobic and resistance exercise are undertaken during a solitary activity session, it has been shown that doing the bout of resistance work first may actually help maintain glycemic balance more so than when aerobic exercise you do occurs after resistance training. This becomes a very, very important for the diabetic control. So there are lots of things you can do like this one, there are balance exercises, flexibility exercises. And if you can do yoga is also very important in the lifestyle modifications because upregulation of insulin receptors and the normalization of insulin glucose ratio also occurs following yogic practices. So this is also very important. If you cannot do anything, you just devote 3 to 4 minutes for the Surya Namaskar. This is a wonderful combination of aerobic exercise and the resistance exercise. And so to heal your mind and body, I say that Surya Namaskar is very, very important. There are lots of research is going with the yoga and the type 2 diabetes. Lots of papers are there. All are pointing that they are very important. So even in type 1 diabetes, this is a different type of discussion, how to manage the type 1 diabetes with exercise. But remember, the very vigorous exercise could not be good for you. This is how the marathon started, that the Greeks sent their fastest runner, Philippi, to carry home news of the victory. He ran 26 miles from the battle site to the city-state of Athens. He arrived and said, "Rejoice, we conquer," and died from the exhaustion at the same time. So this is how the marathon race started. That's why it is very important to understand what should be the intensity, what should be the duration, how frequent, and what type of exercise. As per ADA, aerobics at least 150 minutes per week at moderate to vigorous intensity, and resistance they say at least 8 to 10 exercises with completion of 1 to 3 sets of 10 to 15 repetitions to near fatigue per set be the minimum. In Indian scenario, I want more to be done like all these. So there is a paradigm change in the ADA recommendations also for all these exercises. Timing, sometimes people say कि किस समय में ज़्यादा फायदा करेगा, सुबह में समय नहीं है तो क्या करें? But you can do any time. But I think there is at least some research is coming which says that afternoon exercise is more efficacious than morning exercise at improving blood glucose levels in individuals with type 2 exercise. Remember. So even the afternoon exercise is very, very good, you can say. In the next 2 or 3 minutes, I will say that when there is so many benefits of the exercise, why don't most people prioritize and sustain self-care behaviors like physical activity? Because there is a gap. There is an island of instant goal. You are here. You want to go here. But there is a gap. What is the reason? Because you have to do many works. You think that a big project is a work. There is family needs. There is currents of conflicting obligations. The winds of shifting priorities. Activities that are more fun. And you think that when I do exercise, after some year I can get some benefit. So this is a wrong concept. Remember that if you do exercise, you get the benefit just after exercise. So you have to tell your patient. Even there are lots of things coming that exercise has positive effect on the sex drives of men and it has positive effect on the sex drives of women. So can you tell about it to your patients? That the studies in cardiovascular patients showed that exercise training induces an improvement in symptoms of erectile dysfunction, which is caused among others by endothelial dysfunction. So increasing sex drive can be one goal of an exercise program. But remember, it would be wise to incorporate additional goals like stamina, strength, balance, and stress relief, which you are getting with exercise also. So you tell your patients. But inactive individuals might not know that movement can help them feel better now. And this you have to tell your patients. कि कल का छोड़ो, ये अभी करो और अभी पाओ. तब they will be motivated for doing this regular. So initially my prescription was like this, exercise prescription. I was telling about frequency, intensity, time and type. But later on, after hearing that lecture at the ADA, we also shift to this choose to move. I tell my patients that if you do exercise, what will increase immediately, that is the vitality, you will less stress, you will become stronger, relaxed, well-being, better mood, less anxious, less connected, you will become joyful, you will feel in control, lots of enjoyment you will get, and clear my mind, enhanced sex drive also occurs. So this is the new prescription. You tell your patient how much to walk, how much to do. So this is the very important thing. With that, I think it is already 30 minutes, and I will end here with the message that exercise is the secret weapon to control and revert diabetes. Sitting less can add years to your life. Walking is the best medicine for diabetes. Thank you very much. Thank you.